What is Gamifant? Gamifant, emapalumab-lzsg, is a prescription medicine used for the treatment of hemophagocytic lymphohistiocytosis, HLH, in adults and children, newborn and older, with primary HLH, whose disease has come back or progressed, or other medicines have not worked well enough or cannot be tolerated. Important safety information. Gamifant can cause serious side effects, including infections. Gamifant affects your immune system and may lower the ability of your immune system to fight infections. Gamifant may increase your risk of serious infections that can lead to death. These infections include tuberculosis, TB, histoplasmosis, herpes zoster infection, shingles, and other infections caused by viruses, fungi, or bacteria that can spread throughout the body. Infections are common in people treated with Gamifant. Your healthcare provider will test you for TB before you start Gamifant, treat you with a medicine for TB if you are at risk for TB, or if you have a known positive TB test. The details presented in this video are true and have been shared with the permission of the patient and their family. This video represents one patient's experience and the clinical judgment of one treatment team. Outcomes may vary and are dependent on each patient's clinical profile and history.
My name is Mack.
And your age?
17 years old. I'm from McLean, Virginia. I don't tell people about my sickness, unless somehow it gets out. I went to my friend's house and I set foot on the bed for 2 seconds. I just fell asleep, dead, just tired, exhausted, sickly. My friend's like, "Oh no, you're fine, just stay the night, you'll be fine, you'll be fine." And I'm just like, I'm not fine, I know I'm not fine.
Mr. Super Social, Mack lived for the weekends, and so calling us on a Friday night saying, "Hey, I think I need to come home," kind of looked at the phone like, who is this? This is not my son. So we picked him up and we had an appointment with the pediatrician on Monday, and by Sunday the 12th it was clear that he was really not feeling well. So we took him to the emergency department at Georgetown and they ran their tests and so forth. The first diagnosis was that you had mononucleosis, and they sent us home. It just got to the point where he couldn't even keep water down. So we were worried that he was getting dehydrated, so took him back to the emergency department. I'll never forget it. As weak as he looked, as bad as he looked, they decided they were going to keep him overnight to push fluids, and thus began the journey. The morning of the 22nd, I woke up at 4 a.m. and I looked over to my right, and Mack was on oxygen because he was in respiratory distress. Over the course of 3 days, as his condition worsened, resident comes in, she brings me out to the nurse's station and starts to show me all of Mack's lab results, and literally everything in the red. Every system shutting down. And so I just said, stop. I don't want to see any more numbers. What I want is a conference room with every single doctor that has been involved with his care to this point, so that we can come up with a diagnosis and start treating, because this kid has fallen off a cliff. Finally, the director of pediatric hemonc at Georgetown, kind of said, "I think what we may be dealing with is a very rare condition called HLH." It's very deadly, and typically when you have a confirmed diagnosis, it's usually too late. And so he described the treatment protocol, which unto itself was scary as hell. Chemotherapy, bone marrow, biopsy, and this and that. And so that began, them really working with this diagnosis and treating very aggressively. but he was invited to go to a Sadie Hawkins dance in February. You know, the thing you have to appreciate with Mack is when you say no to him, the negotiation has just begun. And it was a multi-week negotiation with his primary caregiver as to when he could get out so he could go to the dance. So, and his doctor finally relented and allowed him to go to the dance. And you know, this is when he began the treatment with Gamifant. You know, he got sick again in April with a really bad staph infection. That was awful.
I remember waking up one night. I feel like someone had like punched me a little bit, give me like a little like one of those in the side. No, I had to show. And it felt like my ribs were just like shattered.
Then we were admitted for 11 days after that while they dealt with the staph infection. And they had already shared with Nell, Mom and I, that he possibly could need a bone marrow transplant. We just told him that, you know, the only way that this disease can be cured is with a bone marrow transplant.
How's your vision now?
I can't see you. It's black. I can't see the camera. It's black. I can see like over here though. I can only see peripherally.
Right. Just in your right eye.
Mm-hmm. And my left eye's fine though. I think the hardest part was going back. Going back to see these friends at parties and stuff. Obviously not how you want to be seen as in high school with no hair and a lazy eye, so.
Wouldn't you say it's fair to say that, you know, your true friends weren't friends with you because you were popular Mack, they were friends with you because you're
exactly.
Mack? One of the things that I'm proudest of is, I mean, you've never a single time said this isn't fair or why is this happening to me? You know, Mack's story is very unique and he's very fortunate, and you know, we are very blessed that he's able to do this today, but you know, there's a lot of kids that isn't the outcome. Staying active, you know, working with physical therapists, and you know, interestingly, you've decided that you want to be a physical therapist.
Yeah. Just to help other people like I was helped, which would be cool. Yeah, definitely.
Yeah.
Important safety information continued. Before starting Gamifant, tell your doctor if you had TB in the past, or if you or a member of your family have been in recent close contact with someone with TB. Have ever had a positive TB skin test, PPD. Currently have or have had a history of infections, including histoplasmosis or herpes zoster, shingles. Are being treated for an active infection. Have symptoms of an infection, such as fever, sweat and chills, cough, breathing problems, blood and mucus, phlegm, or warm, red, or painful skin or sores on your body. After starting Gamifant, tell your healthcare provider if new symptoms of an infection appear. Symptoms of an infection that you already had when starting Gamifant worsen. Your healthcare provider will monitor you closely for signs and symptoms of infections during treatment with Gamifant. Your healthcare provider may give you medicine to help prevent certain infections before you receive Gamifant, and will monitor you closely for signs and symptoms of infections during treatment with Gamifant. Infusion reactions. These are common, can also be severe, and can happen during or shortly after treatment with Gamifant. Your healthcare provider may temporarily stop your infusion and treat your symptoms before continuing your infusion if you have severe infusion reactions. Tell your healthcare provider right away if you get any of the following symptoms: skin redness, itching, fever, rash, excessive sweating, headache, bone pain, chills, chest pain, shortness of breath, nausea or vomiting, lightheadedness or dizziness, tingling, burning, or numbness, cold hands, arms, legs, or feet. Before starting Gamifant, tell your doctor about all of your medical conditions, including if you have an infection, have received or are scheduled to receive an immunization, vaccine. You should not receive live or live attenuated vaccines while taking Gamifant, and for at least 4 weeks after your last dose of Gamifant. Are pregnant or plan to become pregnant, are breastfeeding or plan to breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. The most common side effects of Gamifant in people with primary HLH include infections, high blood pressure, hypertension, and fever. These are not all the possible side effects of Gamifant. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. Please see the full prescribing information, including patient information and the patient medication guide for Gamifant, at https://gamifant.cares.com/pdf/gamifant-med-guide.pdf.
These are not all the possible side effects for Gamifant. For more information, ask your healthcare provider. You can also see the full prescribing information for Gamifant, including patient information, at gamifant.com/pdf/full-prescribing-information.pdf. To report suspected adverse reactions, contact SOBI North America at 1-866-773-5274 or FDA at 1-800-FDA-1088. Please see the patient medication guide for Gamifant at gamifantcares.com/pdf/gamifant-med-guide.pdf. For more information about Gamifant Care's support services, visit gamifantcares.com.